coronavirus has had a devastating impact on our country, with around 1,240,000 cases reported so far and about 75,000 lives lost to the virus. There's a lot of confusion and plenty of conspiracy theories when it comes to measuring the death toll from COVID-19 right now, but Sue O'Connell has the information you need to know to understand the numbers.
I want to take a moment to talk with you about COVID-19 and the death toll. Not a conversation I want to have, one I'm sure you don't want to hear, but if you're at home like I am and you are online, you're looking at all these conspiracy theories about the government overstating the number of COVID-19 deaths or hospitals making money from COVID-19 patients. So I want to give you some historical information and talk a little bit about it so you can come to your own skeptical yet open-minded conclusions. Okay, first of all, sadly, the number of COVID-19 deaths is not a number we're going to have a directionally correct vision of until we are on the other side of the pandemic. Usually things get readjusted and reclassified as time goes on. We need look no further than to 9/11 to see that deaths are still being attributed to 9/11 long after the terrorist attacks. Folks died from respiratory illnesses or cancers, first responders. It's sad but true that the number of deaths will continue long after, hopefully, the pandemic ends. That's something to keep in mind. Another thing to keep in mind is that experts believe we are undercounting the number of COVID-19 deaths. One reason for that is that we don't have enough testing. The other reason for that is that we don't have enough medical examiners or autopsies or tissue samples. And as that information comes in, the number changes. We are also looking in the past to see if some deaths from 2019, maybe a heart attack, could be attributed to COVID-19. If you had a heart attack and had COVID-19 and didn't know it, and you died, you probably wouldn't have died unless you had had COVID-19. So therefore, that death would be attributed to COVID-19. So the number is changing and evolving. There's no conspiracy. This is how these people, the experts who look at death rates, this is how they classify them historically and on a regular basis. Another thing that they do is they have what they call the theory of excess deaths, the number of excess deaths. Well, what's an excess death? Well, every year experts are able to pretty reliably predict how many people are going to die from cancer, car crashes, heart attacks, and so on. And when there is a major change in that number, as there is this year, meaning there are more people dying this year per capita than there have been in the past, and the only thing different is that we have COVID-19, it is a reasonable and logical conclusion to believe that the uptick in those deaths is due to COVID-19. That's something that experts look at every single year. Now, you may have also heard that hospitals are making money from classifying people as either COVID-19 patients or COVID-19 deaths. While it's true that Medicare does reimburse hospitals 3 times more for patients who are on respirators, that's actually been true. It's not been something that's new because of COVID-19. And as you know by now, a lot of COVID-19 patients have to be on respirators, so that means that the hospitals are getting more money from Medicare because they have more patients on respirators. Another thing you've probably heard is that COVID-19 deaths and patients are making more money for hospitals, that Medicare is paying more money to hospitals if they classify a death or a patient as COVID-19. Well, that is indeed true, but it's also something that hospital administrations have been doing forever when it comes to trying to get more money from Medicare. You can be upset about this. You can be upset that a hospital may classify a death a number of ways in order to get more reimbursement from the government, but it's not something that's new that's happening because of COVID-19. So the takeaway here is that we are undercounting COVID-19 deaths. The number is going to change and evolve as experts do the work that they need to do, and we're not going to really know what the number is until hopefully you and I are on the other side of this pandemic and the experts can look back and classify deaths so that we can hopefully stop something like this from happening again in the future. Until then, wear your mask, wash your hands, and physically distance.